Hartford Health Care is now leading the way with a unique program for lung cancer screening that can really save lives.
And joining us today is Dr. Mark Godfrey, who is the Director of Bronchoscopy and Interventional Pulmonology at Hartford Health Care's medical group. Thanks for joining us, Doctor.
Good afternoon. Thanks for having me.
Doctor, can you tell us who's eligible for lung cancer screenings?
So lung cancer is actually the second most common cancer in men and women, and most people have no symptoms. And so the idea of this is to find it early before it has a chance to cause trouble, and we can offer patients a cure. And the way to do that is with X-ray scans. Obviously smoking is a risk factor. So we try to offer this test to adults who are age 50 to 80, who smoke currently or quit recently, say within the last 15 years, and who have a decent smoking exposure, so averaging about a pack a day for 20 years.
Mm-hmm. And is this something that you would, recommend for those who even have put smoking behind them? It's important to kind of take onus and be active with our health and advocate for ourselves, right?
Yeah, absolutely. So we know that in that population, lung cancer screening saves lives. I have patients in my practice every week whose lives have been saved from lung cancer screening. And so it's important to check with your PCP to see if you're eligible.
So tell us about the process of a lung cancer screening. How does that work? What does it feel like?
Yeah, so the first step is to meet with your provider, talk about your own history, your family history, your risk factors, and sort of what to expect. The scan itself is very easy. There's no IV or X-ray dye. It takes about 5 to 10 minutes and has only a little bit more radiation than a mammogram. And then if everything looks good, we continue scanning you every year. But if something does turn up on the scan, at Hartford Health Care, we have a pretty comprehensive program to get you plugged in for wherever you're going to need to go to get that taken care of.
And we were excited to learn that Hartford Health Care's Cancer Institute actually has the first single anesthetic diagnostic treatment here in Connecticut. Diagnosis treatment, that is. So can you tell us more about all of that?
Yeah, so when people have a suspicious spot on their lungs, they want to know what it is and they want to get it taken care of, and they don't want to run all over the state, trying to do that. And so what we've developed here is a way to bring patients into the hospital for procedure. We use the most advanced robotic instruments to do a minimally invasive biopsy, find cancer, and then a surgeon will take the cancer out in the same episode. So in a single afternoon, you've been diagnosed, staged, and cured of your lung cancer. So it's something we're really excited to offer, and that's only here at Hartford Health Care.
All right, Dr. Mark Godfrey, thank you so much, and we hope people will take advantage of doing this. We appreciate you being here.
Of course, thanks for having me.
For more information, you can go to hartfordhealthcare.org. We also have a link right on our website if you go to WFSB.com so you can get checked.
There you go. All right, we are